a very good morning to all of you. Myself, Keshav Singh, representing here Patient Academy for Innovation and Research. So we are having a series of webinar under this initiative of ours. This is initiative of head and neck cancer patients and head and neck cancer, palliative care patients. So this is our third webinar, head and neck cancer myths and facts, spreading truth from misconceptions. Can we have the next slide, please? So this is a series of 6 webinar. We just to recall, we had our first webinar on 30th of November, which is unmasking head and neck cancer, what you need to know to aid early detection, which the speaker was Dr. Suman Karkarwal from ESIC hospitals. And then we had our second webinar, 20th of December, navigating treatment options, locating the right path to recovery. The speaker was Dr. Priya Tiwari from Artemis Hospital, HOD of Cancer Department. And then we are having our third webinar on today, 11th of Jan, head and neck cancer myths and facts, spreading truth from misconception. Today we have with us Ms. Vandana Mahajan. Can we have the next slide, please? So, for the introduction, Vandana Mahajan is a cancer survivor and has dedicated her life to supporting and caring for those who live with have been affected by cancer. She is a cancer and palliative care counselor and is trained in palliative counseling with a postgraduate diploma in integrative counseling. As a volunteer counselor at the Tata Memorial Hospitals in Mumbai, she has supported numerous families. She also provides psychosocial cancer counseling to patient and caregiver across India and abroad via online platform. She has more than 10 years of experience working in the area of cancer. She is passionately advocates for access of pain and relief and EOLC for everyone who needs it. She is also a passionate patient advocate and very active, raises concern of families dealing with cancer on different forums. And one more special thing about Vanna, she was facilitated by President of India, Srimati Draupadi Murmu, and AWWA for his selfless contribution towards cancer care in India. We are grateful to have you here, Vandana. Thank you so much for giving your time to us, and over to you.
Thank you, Keshav. Thank you for the very warm welcome. And I'm here because cancer is something which is very close to my heart. And I believe people who have the lived experience of cancer are the best ones to bust the myths and the misconceptions surrounding the disease. So I will just share my screen, Keshav.
Yeah, please.
Can you see it?
Yeah, it is visible.
Okay, okay. So before I begin the presentation and general conversation about debunking myths and misconceptions, I want to thank uh, uh, PAIR, the Patient Academy for Innovation and Research, for uh, for giving me this opportunity because I believe the first step towards raising awareness about cancer care, be it any cancer, is debunking the many misconceptions and the myths surrounding it. Cancer worldwide uh, is known to, cause a lot of fear, and I would like to emphasize the fear of death. So the need of the hour is to bust the myths, to debunk the myths. There are many myths surrounding cancer. And as someone who's lived cancer, who's experienced cancer closely, I know how important it is to bust those myths, to debunk those myths, because till we know the reality about cancer, we will always be on the back foot. So today I'm here to talk about the myths and the misconceptions. I just a couple of things that I want to clarify. This is a series on head and neck cancer, but I will be focusing on myths and misconceptions that shroud cancer, all types of cancer. There is no differentiation actually between the myths and the misconceptions. There are very few, and we'll talk about those later. So let's together debunk myths and misconceptions about cancer. So, very, very important to highlight the myths that surround cancer. So, I remember when I was diagnosed with cancer, the my my first reaction was, "Oh no, am I going to die?" And my family, the people around in my life, my friends, everybody was in a state of shock because we believe that cancer is a death sentence, and therefore it is very important to bust this myth. I am here. I'm not dead. I'm very much alive. I went through the treatment and I survived, which basically proves that cancer is not a death sentence. There are many like me who go through cancer treatment, who struggle while going through cancer treatment. It's not easy, but but they do not die. So maybe about 20, 25 years back, maybe even before that, cancer was considered, a disease which had very limited treatment options. But now there's a lot of advancement in cancer care. That cancers that are detected early, this is the key. This is very, very important for all of us to know that any cancer which is detected early has a bigger or a higher probability of getting cured. Even cancers that are detected late, stage 3 and stage 4 cancers, there are certain cancers which have a very good survival rate because there's been a lot of advancement in the treatment modalities. So, cancer, yes, it does cause fear and fear of death, but the reality is far from it. But while I say this, I also want to emphasize that yes, there are some deaths caused by cancer. Um, that is also because sometimes people do not respond to the treatment, right? So the first step is early detection and follow up with your doctors. The next myth I think that we need to highlight and emphasize is cancer is contagious. मैं इसको हिंदी में थोड़ा सा बोलूंगी. ऐसे कैंसर जैसे छूत की बीमारी होती है, कैंसर एक से दूसरे को लग जाता है. And this is a very, very big fear and myth that people in India have. Not only, I have worked extensively with people both from urban India and rural India. And I'm telling you, even with education, people in urban India also believe cancer is contagious. So I want to talk a little about this. Cancer is not contagious. Now, let me give you my example. I have worked extensively with cancer patients. There have been times when I've held their hand. There have been times when I've hugged them. The cancer does not get transferred from me to them. Now let's think about our OPDs. Our wonderful oncologists, our wonderful doctors sit there. They check you, they examine you, they perform surgery on you. If cancer was contagious, then they would be wearing PPEs like people wore during COVID. COVID is contagious. It gets transferred from one person to the other. The common flu that you have when you sneeze, there is a probability of somebody else picking up the infection. But cancer is not contagious. So if somebody in the family has cancer, please, please do not ostracize them. Do not remove them from the mainstream. Cancer is a very difficult diagnosis. And at this time, the support of the family and the community is very, very important. I've seen in a lot of families, the person diagnosed with cancer is sometimes told to sleep in a different place, to have a bath in a different place. People don't want to eat from their plates. Young mothers, or mothers for that matter, cannot are forbidden to feed their children, small babies, from their plate. So husband and wife, their relationship is hindered. The intimacy is hindered, because it is believed that, from the spouse who's been diagnosed, or from the partner who's being diagnosed, the cancer will get, it will get, the partner will get cancer, the other spouse or partner. But this does not happen. Cancer एक से दूसरे को नहीं लगता है. Then the next myth that I have encountered in my experience is, um, if I get biopsy or surgery done, the cancer with the tumor, uh, when that is touched or operated during biopsy or surgery, it will cause the cancer to spread to the other parts of the body. This is an absolutely wrong and information, and a myth and misconception that we need to extensively talk about. Why is a biopsy done? It's very important for people who are diagnosed with cancer, or there is a, there is a some kind of doubt that they may have cancer. They're advised an FNAC or a biopsy. When a biopsy is done, it is done to study the tissue in that tumor or in that site. If the tissue is not studied, then we do not come to know whether it is malignant or not, what type of cancer it is. Once we come to know the type and the form of cancer, then the treatment is further planned. So, why is the surgery done? Surgery is again done to remove the cancer from that site, so that it becomes easier to treat the person who's been diagnosed. So, imagine if you don't get a biopsy done and you go to an oncologist, he wouldn't know how to treat you. He can't treat you without knowing the nature of the cancer or the tumor that you may have. Um, the next myth that I would say is, um, contagious is different. If I have cancer, if the mother has cancer, her children will also get it. If the father has cancer, it'll be transferred to their children. I want to specifically clarify here that only 5 to 7% cancers are genetic, right? Imagine only 5 to 7% chances. If you have a strong family history of cancer, then your treating oncologist or your physician will advise you to undergo a genetic counseling and genetic screening. That will infer whether it is a hereditary cancer or a familial cancer, and it can be transferred or not transferred. Your siblings or your progeny or your the other members in your family uh, have it or not have. So it is very important to know only 5 to 7% cancers are hereditary. Uh, Again, a lot of people believe that cancer will not happen to me because in my family, no one had cancer. How can it happen to me? By God's grace, nobody in my family had cancer. I still had cancer, right? Cancer can happen to anyone with with a family history or without a family history. So what the very important thing for all of us to know is, anyone can get cancer. And if you have any symptoms, for example, a pain in your leg or a extended cough, which is not getting cured, say 15 days, 20 days, please go back to the treating physician and ask for further screening. Why I emphasize this is, the earlier the disease, the cancer is detected, the higher are the chances and probability of curing it. Therefore, please remember, No one in your family needs to have cancer for you to get cancer. I was a very healthy person. I led a very good life, and I was just 35 when I was diagnosed with cancer. Nobody could have thought that I would get cancer. I mean, least of all, me and my family, but I still got it. And I had all good habits, so as to say. There were no vices that I had in my life. But cancer can happen to anyone. We know of a lot of non-smokers. We know of a lot of people who don't take alcohol, because these are the known risk factors, like smoking, alcohol. These are the known risk factors. But there are a lot of people with no history of smoking, no history of alcohol. They still get cancer. So all of us have to be always aware, because unfortunately the incidence of cancer in the world are growing rapidly. India may soon become the capital of cancer in the world. So again, I'm going to emphasize on one thing that all of us need to know. If there is anything that is not getting treated, that you have any symptoms that are not getting treated or still persist after you have sought treatment, please ask your treating physician. Very important. The treating physician may overlook it. Ask your treating physician that I would request you to either refer me for further screening or advise a further screening. Um, Now, if somebody has been diagnosed with cancer, the next fear or the misconception is we will not get chemotherapy done because it'll cause death. If I am alive today, it is because I took the evidence based uh, treatment offered to me. So there are a lot of people who undergo chemotherapy and live very well. So if we do not, if your oncologist advises chemotherapy or radiotherapy or radiation, uh, it is because they know that the cancer in your body is going to be the cancer cells are going to be killed with chemotherapy or radiation, you know, or other modalities of cancer treatment. So do not fear chemotherapy. If unfortunately you do get detected with cancer, do not fear chemotherapy. Yes, there are side effects. I will not deny that. And they are very unsettling, and there's a lot of fear. For example, body image issues come in, baal gir jate hain. Loss of hair is a huge, huge setback, not only to women, but to other people also who undergo cancer treatment. But things like these are reversible. So if you've lost your hair, they will come back after you've completed your chemotherapy, right? So if your immunity is poor, once your chemotherapy is over, your body will regain its strength. If there are side effects that you can't manage, your oncologist, your treating team will help you to deal with those side effects, will provide interventions that will reduce your side effects. So don't let the fear of chemotherapy keep you away from a chance to life. I think the next myth that I have encountered so often is eating sugar will cause the cancer to grow. I mean, this is for all cancers, not only head and neck cancers, for all type of cancers. I've seen diets being advised where people have been told to stop eating sugars. I know Google Baba, the internet guru. There are a lot of articles on how eating sugar will cause the cancer to metastasize or grow faster. This is an absolute myth. Please go to a good onco dietitian. It is very important that you see an onco nutritionist, somebody who has knowledge of working in oncology care, a nutritionist who works in oncology care. And if you stop eating sugar altogether, your blood glucose levels will fall, and it will cause other problems. We've seen people fainting because they stop eating sugar altogether. Please, you don't need to stop eating sugar. Anything that you eat any kind of food that you eat. For example, there is a myth that having dairy will cause cancer, right? Having maida will cause cancer. It's not like you're going to eat, a lot of it all together. Anything that you eat in moderation. For example, eating, if you love having sweets, please remember extra sweets will cause diabetes and weight gain. Now, weight gain is a curse for cancer. Obesity is a known risk for cancer. So eat sugar, but in moderation. The next one is bad thoughts or negative attitudes will cause me to develop or die from cancer. How is this possible? Your bad thoughts or your negative attitudes, or if you are stressed, do not cause cancer. Number one, will not cause you to die from cancer. Yes, if you are stressed, or if you are not in a good mental space, it affects your body, your mental and physical body together. And maybe it will uh, in some way compromise your immunity, right? But it will not cause cancer to happen, or it will not cause cancer to spread so that you'll die of cancer. This is an absolute myth. Next is मेरे बुरे कर्म थे इसलिए मेरे को cancer हो गया. My bad karmas. And a lot of people actually believe this. They believe that because they've been bad people and there were some bad karmas from past life, that is why cancer has happened to them. I have no bad karmas. I'm a good human being. I mean, I'm telling you, I'm a good human being. Cancer still happened to me. I know such wonderful people who've not, if you were to qualify people as good or bad, uh, they've not done any harm to anyone, wronged anyone, done anything that it qualifies as bad. That is our perception. But cancer still happened to them. So cancer can happen to anyone. You just need to be active. You need to be alert. You need to reach out to the doctor on time and get treatment. Now there is so much myth and stigma around cancer, around the conventional cancer treatment that is offered by oncologists, that people opt for alternate medicine. I have nothing against alternate medicine. This is again my personal experience and the experience of what I have learned from, I think, thousands and hundreds and thousands of families that I've interacted with, that I counsel. That please, the first thing is to reach out to someone who provides evidence based treatment. That is your medical oncologist. That is your surgical oncologist. That is your radiation oncologist. This is the treatment that they provide has been, for so many years, has helped people get better, has helped people live longer and better life. If you have faith in alternate medicine, please, please go seek alternate medicine. But please remember, alternate medicine does not cure cancer. It can help you manage symptoms. Also, another thing that I want to emphasize here is, if you choose alternate medicine, be it homeopathy, be it Ayurveda, be it, medicines from the Tibetans, please tell your treating oncologist about it, because sometimes the medication advised by alternate medicine practitioners can interfere or are contradictory with your treatment offered by oncologists and can result in serious side effects. So these are some common myths that surround cancers. Now, if we move to head and neck cancers, so this is just an image of head and neck. I would like to say that a lot of people believe head and neck cancer is caused only by smoking and drinking. Yes, people with a history of smoking are have a higher probability, or the risk factor is higher. But these smoking is not the only cause of of head and neck cancers. You need to know more about it. Please speak to your treating oncologist, and they will tell you the various reasons that are there. Now, head and neck cancers definitely are very difficult, right? I mean, something that happens in your mouth or in your head or your neck. Definitely, when you undergo, say, a surgical procedure for it or a radiation at these sites, it will come with side effects, which are unfortunately very difficult to manage. A lot of people believe that if I take treatment for head and neck cancers, it will affect my ability to speak, breathe, and swallow. Yes, while you undergo surgery, for example, cancer of the vocal cords, or maybe cancer of the tongue, or a cancer in your jaw, uh, they do inhibit your ability to, say, speak or to swallow or to breathe. But then there are people who've undergone rehabilitation, and they lead very good lives. For example, there are speech specialists or therapists who can teach you how to modulate your voice, and so that you can speak. There are people who will teach you how to swallow post taking radiation or surgery for head and neck cancers. So do not let the fear stop you from seeking treatment. Yes, it is very difficult, I know, and in my experience as a counselor, I think I wouldn't be wrong in saying that people who undergo treatment for head and neck cancers really struggle far more than others, because of the disfigurement issues, the ability to not eat or swallow, because a lot of them sometimes have to be fed through the Ryle's tube or the PEG tube. But when you are going through such difficult treatment, it will come with a lot of emotional baggage. It affects your emotional faculties also. Capable. So therefore, you need to reach out to a counselor. There are counselors who are trained in onco counseling. For example, there's I'm a counselor who's trained in counseling people who've been detected with cancer. Please reach out to them. They will help you. They'll help you. They'll be your sounding board. They'll guide you through this difficult time. I've seen sometimes a lot of people with head and neck cancers. They shy away from interacting with people outside. Yes, it is tough. Again, I'm going to emphasize again, it is tough. It is not easy, but there are many modalities available which can, in some way, help you get back some of the normal that you have. So, um, do reach out for help. Head and neck cancers are always deadly. For that matter, all cancers are considered to be deadly. But I'm again going to go back to what I said earlier. Any cancer which is detected early has a higher probability of a cure. So please be careful please be aware of, as I always say, be aware of what your body is telling you. Listen to what your body tells you. You have to hear it speak, it does. And place your health as priority. Now, why is it important to debunk the myths? For example, now let's see this. This picture in itself is going to tell you why it is important to debunk the myths. So, myths and misconceptions about cancer treatment frequently fog the minds of the patients and their families, which actually causes more fear, which causes doubts, which causes a lot of times people to take wrong decisions. I know of a lot of families who were told by well-wishers, the so-called well-wishers, that don't get a biopsy done. Oh God, if you've got a biopsy done, that's the end of it. Now you can't be cured. And those families lost hope. while there is still a lot of hope. I also know a lot of families where the person diagnosed has been ostracized, has not been included in the mainstream, has been abandoned because it is believed that cancer is contagious. So, therefore, it is very, very important that you reach out to the right resources. I would like to commend Pair for doing this one extensive, webinar on just busting the myths, because this is how you get right and authentic information. So please reach out to resources which give right and authentic information. Sometimes delay in biopsy can cause the cancer to metastasize. The cancer will spread so much that the probability of treatment becomes dimmer. So, therefore, it is very important that people, the society, the community has access to right resources so that we can debunk the myths. And now let's talk about barriers faced by those who are diagnosed with cancer. Number one, I would say, is the stigma. The stigma stems from the many myths and misconceptions, which has resulted in the society forming a certain perception about cancer. So, very important to to talk about the stigma and clear the misconceptions around it. Now, I think the next if somebody gets diagnosed with cancer, what is the next step? Treatment. Now, what does treatment entail? Treatment for treating, for any sort of treatment, you need money. And unfortunately, cancer treatment is expensive. So financial constraints are a very big barrier. Treatment, like I said, high cost of treatment. Unfortunately, there's a lack of insurance schemes. If I were to ask the audience, how many of you would all actually know that the Ayushman Bharat scheme gives a coverage of 5 lakh rupees? How many of you here would know that now palliative care is also a part of Ayushman Bharat? So there is a lack of insurance schemes, and there's also lack of awareness about the insurance schemes. So this is a big barrier. Now, inequity in cancer care, I think, has to be the biggest barrier ever, be it the availability in accessing hospitals, be it reaching out to the right oncologist, or be it lack of financial support. So inequity in cancer care comes in various forms, and there are people who have insurance, but the out of pocket expenditure is so much because not everything is included in the insurance. So there is a study which says sometimes the cost of treatment, the out of pocket expenditure rather, is far more than the cost of treatment. So in out of pocket expenditure, travel cost, accommodation, eating, supporting your family is outside of your cancer treatment. So this is again a big barrier. I've already spoken about lack of infrastructure. I've worked as a volunteer at Tata Memorial Cancer Hospital, Mumbai, and there are people from West Bengal, from Bihar, who travel with their families to these institutions because there is a lack of accessible hospitals. While I say this, I also want to say that there is a lot of change that has happened. There are hospitals that are available, but people are not aware of it. Through forums like these, we need to talk about the cancer facilities other than maybe say AIMS, Rajiv Gandhi, TMH, because there are other hospitals also which provide good cancer care. Rural areas have lack of access to specialized facilities. I, you know, it's so unfortunate sometimes somebody who has a diagnosis cannot get an MRI done, or maybe a simple procedure like an ultrasonography, because it's not available in their Vayundi village, is not available in their town. I know of people who've said in the entire district there's only one PET scan available. Now, these are huge barriers. So, the influx of people from rural India to urban India is also because of lack of specialized facilities. There's a delay in diagnosis. One of the primary reasons why most cancers are delayed late is because our public healthcare systems are not equipped for early detections. Even our primary physicians are not trained to pick up symptoms of cancer. So, for example, a lot of times, an untreatable ulcer in your mouth will be told to you that it is maybe some kind of infection, fungal infection, or because you're biting your teeth are constantly biting your inside of the mouth. That is why they keep treating you with medications, and the ulcer does not heal, and ultimately it gets progressed, it gets diagnosed as cancer. So these are some of the barriers which we collectively need to overcome through awareness, through talks, through forums like these. Now, some of the misconceptions about navigating the healthcare system are, now somebody who's being treated for cancer, right? They go for the first follow up, the second follow up, the third follow up. The doctor says everything is good. No, there's no cancer. Then you tell yourself, I don't need to go for a follow up again. I'm totally cured. I remember when I was going through my cancer treatment, I was told right in the beginning by my the doctor who was treating me that when I ask you to come in 6 months, ensure it does not become 6 months one day, and I still follow it. I'm very regular with my follow-ups. I'm very regular with my blood work for my cancer markers. I'm very alert to what is happening inside my body, and I don't take a chance. I don't depend on anyone. I go reach out to a doctor so that I don't miss out on a symptom. Please remember, any symptom which is caught early is easy to treat. Life will continue. Your kids will continue going to school, especially for women in our country. Your house will still run very well. Your husband will still go to office. Your in-laws will still be taken care of. But if your diagnosis is delayed, what you go through is something that you need to constantly be aware about. So do not delay your follow ups. Do not tell yourself that it's been 5 years, I don't need to go for a follow up, till specifically you're told by your oncologist. A lot of people say, मैं बहुत छोटा हूँ, छोटी हूँ. I don't need cancer screening. Unfortunately, a lot of young people are getting diagnosed with cancer these days. So please, again, the thing is, if your body is telling you something is wrong, please go and get yourself examined. Again, it's the same thing. Yeah, and I think this is one of the biggest. We like to believe that bad things happen to others, it cannot happen to me, right? So you need to tell yourself that yes, even though I'm healthy, I follow a healthy lifestyle, I still cannot rule out the possibility that cancer may happen to me. When you tell yourself, you don't have to be paranoid about it, but if you are aware, and God forbid something does happen, it can be detected early. Now, this again, we need to emphasize on a lot of young people, a lot of even families don't believe that health insurance is not for them, right? If you're young and healthy, if you have young children, you don't need to buy health insurance. Please remember, nobody knows um, when an illness like cancer can happen to anyone. So be prepared rather than struggling with your finances and insurance after a disease is diagnosed. So it is a good idea to buy your health insurance. Now, since I work a lot in palliative care, that is where my work, the focus area is. A lot of people who are advised, say, a palliative care, or who are told to reach out to a palliative care team, say ask this, that am I dying? Why have I been advised palliative care? That's not the case. Palliative care is for everyone, anyone who's been diagnosed with cancer, be it stage 0 or stage 4, or be it somebody who's at an of end of life. So if you should rather ask for palliative care at at the time of diagnosis. So palliative care it's going to help you in various ways. Help you through emotional counseling. It'll also help you by providing guidance through social workers. If you have any spiritual distress, you don't have to be dying to have these problems. There is form of spiritual distress. A lot of times there are questions like, why me? Right? I'm useless now. So palliative care team can help you deal with it. Palliative care team can help you deal with the pain that comes because of the symptoms and the disease. Um, this again, I am a counselor, and I've heard this so many times when somebody reaches out to me, and uh, if an oncologist tells a patient that reach out to Vandana, she is a counselor, a lot of them don't want to come and talk to me, because we have believed that there's a societal perception that seeking emotional support is only for people who are mad. No, when I was struggling, when I was going through my cancer treatment, emotionally, I was a wreck. I'm telling you, I was a wreck. And I, at that time, took the bravest decision of reaching out to a counselor and a psychiatrist who helped me deal with my emotional uh, baggage, the emotional pain that I was carrying. And today I can very proudly say that it's put me in a much better space. Counselors are meant for your support. Reaching out to a counselor does not mean you are weak or mad, right? Counselors will help you navigate your emotional burdens during a difficult diagnosis like cancer. I also want to talk about, since we are talking about misconceptions, it is very important to talk about the cervical cancer vaccine. A lot of people believe that the HPV vaccine, which is now easily available in India, is only for females. No, HPV vaccination is for both male and female. So please ask your doctor from it, because unfortunately or fortunately, this is the only vaccine which can prevent cancer, cervical cancer, penile cancer, and oral cancers. Please ask your doctor about this. Uh, if you're treating oncologist, unfortunately, if the cancer is no longer treatment is responding to the treatment being provided, your oncologist may say that there's nothing that can be done. And at that time, the female families feel that they're being abandoned. Your oncologist basically means that in terms of providing cancer treatment, there are no more options available. But a palliative care team at this point will support you, will walk with you right till that death. So please seek palliative support. And specifically to, I would say, head and neck cancers. I know people with impaired speech. I know people who have difficulty in swallowing, who have to constantly undergo procedures to open, in simple terms, open to widen the opening so they can swallow. I know people who've undergone, say, a removal of the jaw or the tongue. Um, who have the courage and the will to live well. They step out, they they've created their own normal, because let's all, let's all understand death will come when it's meant to come. The choice lies with us, whether for as long as we are alive, even with the challenges that come with the cancer treatment. Do we want to live well, or do we want to live poorly? So, at this point, it is very important to seek support of your counselor. And why I am here. I'm here to talk about cancer because I have experienced it. And somebody who experiences it can definitely connect much better to the people who are going through a similar journey. So, talking about your cancer journey not only empowers you, but it also empowers others who are walking a similar path. So do not worry about societal perception or what people will say. If you want to share your story, please remember there are so many people whose lives will become better after hearing you. And lastly, I would say, I have to be strong all the time. No, you don't have to be strong all the time. You don't have to be. There were times when I broke down, when I cried, when I told people I don't want to see you. I told people to leave me alone, and it is okay. It is absolutely okay because what you're going through is very, very tough, and you don't have to be strong for anyone. Please remember, it is okay to cry sometimes. It is okay to say that life has been unfair to me, and also to the caregivers listening, to the people listening to to this webinar. I want to tell you that yes, cancer is a difficult journey, but sometimes your expectation that your loved one has to be strong all the time is far more demanding and debilitating on the patient. So it's okay to be weak sometimes. And if you're not able to cope up, again, reach out to counselors and oncopsychologists. I've already spoken about my personal journey here. In the end, I want to say that the whole rhetoric against cancer being a war needs to go. No, I'm not a warrior, right? I am just not a warrior. I did not fight a war. Then there are so many millions of people who go through cancer treatment. Not they are also not fighting a war. It is a disease. It is a disease in which some people get cured and some do not. So that doesn't mean people who get cured are fighters and warriors, and they are, some they fought a war and they've overcome it, and people who died lost a battle. No, I think each one of us who gets diagnosed with cancer travels a journey and does not fight a battle. Thank you so much.
Thank you so much, Vandana. You just beautifully busted all the myths and misconceptions which are in the society. And yes, there is so much myths which is in rural areas also, and that that is which is not very much uh, aware of. So many of the patients I met in the field is like they are not coming forward because they have some myths. They have myth of neglecting from the societies, so they are not coming to the doctors for early detection. That is the main reason why early detection is not going to happen in our areas. So this is very informative webinar. So there is a patient we met in, so we are having a awareness session in slums also. So there is a patient which is like, my grandparents are also used to chew tobacco, and my dad is also chew tobacco, but they don't have the cancer in that time. Why I am getting cancer in that time when I chew? So that type of misconception in the field there is. So we have a question, which is, just a second.
Sure.
So what are the policies and protocols for palliative care in cancer, and how they can be improved for us in India?
Okay. Okay. Policies and protocols for palliative care. Keshav, like I said in the presentation, that palliative care is for everyone. When we talk of cancer
Yeah.
care, palliative care is for everyone who's diagnosed with cancer. Right? So the right protocol is that right at the time of diagnosis, anyone, even if it's a stage 0 cancer or stage 4 cancer, um, should be referred to a palliative care team. So the right
Yeah.
protocol is having a multidisciplinary approach in which one of the disciplines is integrating palliative care at the time of diagnosis.
Yeah. So how can we improve? Like we are a patient organization, you are a patient advocate. So how can we put our efforts to improve these things to get patient a palliative care thing to their setups? So how can we put efforts for this?
Yeah, I think
How?
thank you for asking that question, Keshav. If we talk of oncology specifically, we need to encourage our oncologists
Yeah.
to integrate palliative care at the time of diagnosis. We also need to educate people, be it healthcare professionals or patients and caregivers, about what palliative care actually means. Still, a lot of very learned people and the experts in field of oncology still believe that palliative care is end of life care. Palliative care is only when you advise the patient best supportive care. So we need education. We need more awareness campaigns. We need people in palliative care to come and educate, take sessions for healthcare professionals, for patients, so that we can collectively convey the message that palliative care is for each and everyone who's been diagnosed with cancer. I think that is the only way, education and awareness. And
Exactly.
also, Keshav, while I say this, I would also like to add that we need to empower our patients to seek palliative care,
Yeah.
right? Sometimes our oncologists are very busy, and
Exactly.
even, yeah, so they may just overlook it sometimes. So their patient advocates like myself, we need to have more patient advocates. Unfortunately, patient advocacy is still very niche in India. So we need more
Exactly.
organizations, more people to be trained as patient advocates, so that at the time of diagnosis, they are guided about all modalities that the patients and their families can access. And in them,
Exactly.
palliative care, yes.
There is a need of referral also to oncologists refer to patient advocates to seek their help and their guidance to the treatment. That is also much needed, as you rightly said. Thank you so much, Vandana. That is a very great webinar we had. You busted all the
Thank you.
myths. And
I'm
thank you
happy to be a
everyone.
part of this.
Yeah, thank you everyone for joining us today, and have a great weekend. Thank you so much.
Thank you, Keshav. And I also want to thank Dr. Ratna Devi for this opportunity. Thank you very
Yeah,
much.
thank you.
Thank you. Thank you.